I'm your host, Richard Hara, and this is Social Impact Live, a weekly conversation with members of the Columbia School of Social Work community. So I'm very happy to welcome to our program today, Erica Eliason, who's a PhD candidate at the School of Social Work, has recently published an article on the effects of Medicaid expansion on maternal mortality in the United States, and published in the journal Women's Health Issues. That's correct,
Yes.
Erica? Yeah, and actually received the Charles E. Gibbs Leadership Prize for the best paper published in that journal in 2020. So congratulations.
Thank you very much.
It's great to have you here, and we'll certainly be talking about the article and the research that it's based on. And more generally, all of these issues that are connected to healthcare in the United States, particularly now in the age of COVID. But I noted in your background that you have an MPH from Columbia as well. And also you were a research scientist for the New York City Department of Mental Hygiene. If it's okay, can you tell me a little bit about the work that you were doing there?
Yeah, so I was a Medicaid claims analyst. So I was working on Medicaid for the city, looking at health outcomes among New Yorkers with Medicaid. So that's what brought me to the PhD, was really wanting to focus more on Medicaid policies. And Heidi Allen here at the School of Social Work is a Medicaid expert. So I was lucky enough to be able to work with her.
And I understand that you've been doing other work related to Medicaid expansion with Professor Allen and also some other postdoctoral researchers here at the School of Social Work.
Yes, we published a couple of papers looking at Medicaid expansion and evictions last year.
Okay, well, so there's a bit of a through line.
Yes.
Getting your MPH, working in city government, looking at the effects of Medicaid and public health, and now deciding, I guess, wanting to get your PhD and looking to teach in the future, continue as a researcher, maybe go back into the public sector and start shaping policy. What are you thinking?
So I'm actually on the job market, so thinking a lot about this right now.
Yeah.
Probably doing a postdoc next.
Okay.
Definitely want to continue doing research and in maternal health and Medicaid. So that is the area that I see myself going into. Okay,
well, wonderful. So let me ask you about your research and this article. So set the stage for me. This is sort of what happened after the implementation of Obamacare, Medicaid expansion taking place in a number of states, but not all states, right? Because the Supreme Court ruled that states could opt out of Medicaid expansion and so on. So what was happening with maternal mortality at that time, and what changed after?
So the United States has the worst maternal mortality of developed countries. So it's quite high. And what I found was that Medicaid expansion was associated with lower maternal mortality in those states that did expand their Medicaid programs. What's interesting, though, is it's still increasing in both states. It's just lower in the Medicaid expansion states. So that does show that this health insurance isn't the full story. There's a lot of other factors that are contributing, and a lot of work still to be done on maternal mortality here.
It's interesting. So I mean, how are you able to compare the different kinds of states? And can you give me an idea? I mean, how many states we're talking about when we're talking about states that did expand Medicaid versus those that didn't? Is it kind of a 50-50 split, or are we really talking about a smaller number for the former?
So I think at the time of the study, maybe 19 or approximately had yet to expand, and states are continuing to expand, which is great. So the majority of states had expanded their Medicaid programs, but because there is this comparison group of states that didn't expand and states that expanded at different times, you're able to kind of exploit that variation to look at what are the outcomes in the states that expanded over time, and the states what are the outcomes in states that didn't expand over time, and compare them. And that's how you're able to see what the effects of Medicaid expansion were.
Ooh, okay. Before we continue, I just want to remind our viewers that we do take questions. We have time reserved at the end of the program for Q&A, but if you've got a question now, certainly type it into the chat box and we'll try to weave it in earlier rather than later into the program. So yeah, definitely if people have questions, to please go ahead and type them in now, and we'll get them to Erica to answer. So you were saying before that maternal mortality is still increasing,
yes,
but at a slower rate than what we saw before Medicaid expansion, correct?
Yes, and it's lower in the Medicaid expansion states.
And it's lower in the Medicaid expansion. So, but it's also lower in the non-expansion states as well?
No, it's still increasing there.
Oh, it's still increasing. Okay, that's an important point then.
Yes.
So that gives us a general picture, but I think you've sort of examined the data a little bit more closely, and in particularly, what are the racial disparities in the numbers that we're seeing here? So what did you find?
So this is really important as a component of this, because Black women have much higher maternal mortality than white women. They die at a rate of maybe about 3 times that of white women. So in addition to looking at the effects overall, I was able to look by race, ethnicity. And I saw that the effects of Medicaid expansion on maternal mortality were much larger for Black women, about 16 deaths per 100,000 live births. That was the reduction, whereas overall it was about 7 deaths. So much more pronounced effects for Black women, which could mean that Medicaid expansion is contributing to reducing the racial disparities in maternal mortality.
So that's important news, I think. With that yes. particular area, and I'm just wondering, can that serve as a model for better understanding racial disparities in health care across the board? Do you think? I mean, what are the mechanisms that are sort of helping to create this effect, if you will, right? Better outcomes for Black women. And is this something that speaks to disparities in healthcare according to race more generally?
That's a great question. It's hard to kind of tease out the effects. There are multiple pathways that this Medicaid expansion could be having an effect on maternal mortality. So I try to tease it out a little bit. So there are late maternal deaths and then kind of maternal mortality more broadly. And so I look at the definition of maternal mortality with and without the late maternal deaths, because one of the pathways that's been getting a lot of attention recently is extended postpartum coverage. So there was pregnancy-related Medicaid coverage already in existence prior to the ACA that gives women coverage once they get pregnant and for the duration of their pregnancy up to 60 days after. But what the Medicaid expansions did is they gave women coverage before pregnancy, in addition to during pregnancy, and then after pregnancy as well. So the mechanism is probably in this preconception period, so better health going into pregnancy, and in this postpartum period where women are not losing coverage after pregnancy anymore.
Okay, all right. So interesting. So we're looking at 3 distinct phases of care.
Yes.
Okay, and that's consistent. I mean, you're looking at them across the different states, and according to Medicaid expansion and non-expansion. So that's a constant factor across all 3 phases. Is that right? Yeah.
Yeah, I think the preconception and the postpartum periods are really the phases that are having the effects here, rather than just the care received during pregnancy.
Okay, interesting. So I'm I'm curious. Well, let me just see. I've got some questions here. I said we would try to get to them earlier rather than later. So, first question: do you know how COVID is affecting women's ability to access the care they're entitled to? So, yeah. So, any information about that?
So a lot of prenatal care during COVID has been telehealth. And it's hard to say what the effects of that have been. There have been early studies on, early just because it's ongoing. There's not a ton of data yet on the effects of the pandemic. So not necessarily somebody who has COVID, but all of the changes to women's lives under COVID. So working from home, maybe getting their care through telehealth, the lockdowns, and the outcomes on births and maternal health have been kind of mixed. So I think what they found actually was that there's a reduction in low birth weight deliveries and a reduction in preterm deliveries. And then there was some evidence potentially of higher stillbirths. So it's mixed and ongoing. And all of those studies that I just mentioned were in Europe. So from what I've seen so far, they haven't looked in the United States at what those effects may be of COVID or of the pandemic more broadly.
Yeah, and maybe this is a lead into another question that we've gotten. Might Medicare for All improve infant mortality rates even more, since you mentioned infant mortality just now? So
yes.
And I don't know, maybe this is somewhat outside of the scope of your research. So, but if you don't mind speculating.
I would love to. Yes, Medicare for All would be great because then people would have coverage all the time, and so there would be no concern about the effects of losing coverage on maternal or infant health outcomes.
Okay, well, I certainly it's a consideration. I think sort of wondering, with a lot of healthcare reform, and also maybe with regard to Medicaid expansion. I mean, the pushback, right, from some states has been what, that expanding Medicaid is going to contribute to increasing healthcare costs generally by maybe sort of driving people to more hospital-based care. I mean, what has been the sort of counter narrative to all of this that I'm sure you've had to consider as part of your research discussion? Are there alternative explanations for what's happening with maternal mortality, and whether or not there really is a correlation between falling mortality rates and Medicaid expansion?
Do you think? Sorry, is there an alternative explanation for the results that I saw?
Yeah.
I don't think so. Just because when I graphed the data over time by state, it was very clear that there was this continued increase in maternal mortality in those non-expansion states that was not true in the expansion states. And the timeline for when those trends diverged corresponded to Medicaid expansion. So I just found it really convincing that is what was happening there.
So not just the numbers, but the timing, right?
Yes, absolutely.
Absolutely. Figures into your analysis and your conclusion. So I'm just sort of, I don't want to say stuck on this point, but I'm just curious with Medicaid expansion. Is there a downside to it?
Is there a downside to it? Well, I don't think so.
Okay, all right.
I think that the main reason that states didn't expand originally was political rather than actually being based in science. And you can see that somewhat with the states that have still yet to expand. There's, geographic clustering, and it was, much more likely that, Democrats expanded their Medicaid programs than states that are Republican.
Mm-hmm. Mm-hmm. And most of your comparisons work focused on looking at states like California that expanded and so on. So, yeah, I did, sort of thinking about all of the states that expanded and so on. Were there any outliers? Any states where the results weren't as robust as they might have been in a place like California, which seems to have that kind of system in place for poorer and underserved populations? And yeah, just curious.
So the approach that I use kind of aggregates it by expansion status.
Okay.
So I can actually look, I'm underpowered is the statistical term to look by at the state level, because some states actually have, 0 deaths, maternal deaths in a year. And so then if I were to look at the state level, if there was, 0, and then all of a sudden there was 1, it would look like this big increase, or, vice versa, this big decrease, but actually it's just the difference of like 1 person dying. So there aren't enough maternal deaths, luckily, to do that level of analysis with the data that I was using.
Okay, so yeah, statistical power, it just isn't commensurate with what you're seeing with other states. So, all right, let me go back to the questions that have been submitted. I gotta go back up because I've missed quite a few. I understand that the United States has the worst maternal mortality rate in the developed world, and it doubled between 1987 and 2014. What were the reasons for that increase during that particular period of time?
I am not sure. You would think that we would have this figured out by now, and unfortunately we don't. I wish that I could say there's so many mechanisms at play. And like I was saying just when I was trying to figure out, the pathways with my own data, it's kind of hard to disentangle. There are just so many factors. And I can't say with the data that I have.
Yeah, and even given those data, I mean, we're probably, we don't appreciate fully the disparities, right? That, we're looking at general numbers of the United States, but that's probably masking tremendous difference between white and Black populations. I would wager.
Oh, absolutely. I mean, that's why I had to look, by women's race, because overall, the effects were 7 deaths, but once we actually looked at the Black population, it was 16 deaths. That's a huge difference. And that shows that population was really driving the effects that I was seeing.
And do we have comparisons with other countries, sort of developed countries and so on, according to race, that we can compare the United States against?
I would have to look that up.
Better than us. Yeah, I'm
yes,
curious.
Yes, they are, but I don't know what those numbers are.
Okay, all right. Well, yeah, I mean, that's important enough point to make. Let's see. A question, and this is, I guess, about as a doctoral candidate, how does it affect a student's career to publish an article in a journal at this time? It's interesting, yeah, and to receive a prize for it, no less.
Thank you. I think it is beneficial to one's academic career. If they want to go into research, it is helpful to publish to show that you know how to write a research paper, you know how to do analyses, and that you're kind of familiar with the process of moving a paper along through those stages.
Yeah, don't doctoral programs focus more on their students writing papers for publication rather than the massive dissertation that people used to sort of focus on and take decades to complete? I mean, I don't know, I'm maybe exaggerating here, but I think there's definitely more of an emphasis on working on these kinds of projects than something that really might make, would be a lot more difficult to manage, over time. I don't know.
Yeah, so actually the Columbia Social Work has 2 pathways for its dissertation. You could do kind of what you were talking about, that big, maybe book format, or you can do 3 papers. So it would kind of look like, this paper, but then 2 additional ones that would form the dissertation with, some introductory and concluding remarks, and you tie them together as a theme of your work. But I do agree that I feel like that's much more manageable for me to think about these as 3 concrete papers.
Right.
And then it's easy to publish them because you just send them off.
Yeah, and then once you've had them published, I mean, that's something to put on your CV, and that helps you out in the job market. So
Yes.
win-win all around. Let me see, other questions. Did your research look at all about the quality of care provided by Medicaid accepting institutions in comparison to private hospitals?
So actually, I am looking at comparing Medicaid for pregnant women and private insurance for pregnant women in a different study that I'm doing. It's not looking at maternal mortality, it's looking at access to care, so prenatal care utilization, and also, their coverage patterns. So if they have, less loss of insurance coverage or those sorts of things, and then childbirth outcomes. And I'm finding actually more prenatal care utilization among women with Medicaid. And so what I think the pathway for that would be is that women with Medicaid have lower cost sharing. So, they don't have to pay when they go see a doctor as much as women with private insurance usually do. And so this would be a good thing. They're utilizing more care as a result of that, and getting more adequate prenatal care because of that. So I'm not looking at the quality of the providers necessarily, but I can look at their care access and utilization.
Okay, wonderful. Let's see, is there data segregated for maternal mortality and health outcomes for women who are incarcerated?
That is very interesting. I don't know if that exists. The maternal mortality data that I had is at the state level, so I can't see information about if they were incarcerated or kind of the characteristics of the individual woman who's dying, besides, aggregating it by race or aggregating it, by age or other things. But that certainly wasn't in the data that I used. And I don't know if that is out there, but I feel like it should be.
Yeah, it's a basic question, and I should have asked this at the outset, but where did you get your data from on mortality? I mean, this is something that's part of the public record, or where do you get it?
Yeah, it's public CDC data. You can access it through, it's called the Wonder database, and it's their mortality files. And then I linked that to the natality files to get the denominator of live births.
So you're somewhat subject to how they collect the data, and disaggregate the data also, right?
Yes. Yeah. So I did not collect this data. So there's, lots of data I wish I had for this population that is not available, and for a good reason, because if this were that granular, then they're worried about potentially somebody being able to identify people, and so for confidentiality reasons, that's why it's kind of only aggregated.
Okay, all right. Let's see, another question. I have a bunch of questions here. Does the fact that the expansion contributed to more improved outcomes for Black versus other mothers, does this suggest that funding for services is more a significant factor in successful outcomes for Black versus other funding for services? Yeah.
Yes, I think that means that Black women were not getting enough healthcare prior, and because they had such higher rates of maternal mortality, there were bigger effects for that population.
Okay, and there's another comment here. One possibility that contributes to the increase of mortality could be the massive increase in wealth and income inequality between the mid-1980s and now. Wealth of the top 1% skyrocketed while wealth of the bottom 40% fell. Inequality increased drastically. So this is a reflection, a function of just what's happening in society generally, right? With that increased wealth gap, if you will. And so on. So that, okay, no more questions at this time. So we got them all under our belt, and it gives us a few minutes to just sort of talk about where we go from here.
Yes.
You know, either your future research, but also I think for a lot of our audience, I mean, what can they do to sort of you know, help improve, you know, or contribute to this effort to improve maternal health care and so on. So.
So actually, all of those things are intertwined for me. So I believe I sent a link out. I'm not sure if it made it into the chat, but it's something that everyone could do if they're interested. So where I see my research going, and something that I kind of call for at the end of my paper, is that there's been a lot of push recently to extend postpartum Medicaid coverage for pregnant women. So I think I mentioned women have pregnancy-related Medicaid coverage that ends 60 days after childbirth. And so women in the postpartum period are losing health insurance coverage, you know, very recently after having a baby. And that's a crucial time to be, you know, getting healthcare for postpartum women. So these Medicaid extensions, so far there've been 2, California and Texas, but there's been a call for them to be everywhere, and to let states extend this postpartum Medicaid coverage. So the link that I put is in support of one of those initiatives, if people are interested in looking into that and signing it. And then that is an area of future research for myself. I want to look at the effects of these postpartum Medicaid extensions on maternal mortality, maternal health, you know, postpartum care, and disparities.
Maybe this is just opening up a whole another area, and maybe we need to bring you back at another point to the show to talk about it. But just thinking, I mean, about prenatal care and other issues related to sexual and reproductive health. How do you see your work as sort of maybe kind of continuing and being leveraged, right, in those areas? You know, access to contraception, even abortion, right? And what might that mean for women's overall health, and by race or otherwise? And yeah, what are your thoughts about that? I know it's a big area to unpack, but.
Yeah, so there have been studies looking at Medicaid expansions and other areas of sexual and reproductive health. So they've seen increases in family planning services, contraceptive services, and even abortion. Although the abortion one is only in some states, because what's called the Hyde Amendment prevents federal funding to be used for abortions. So if a state were to cover abortions in their Medicaid programs, it would have to be state financed. So the study that I'm thinking of was in Oregon, and they saw an increase in abortion utilization after Medicaid expansion there, because they're one of the 16 states that finance abortions in their Medicaid programs. But some of my other research, I look at the effects of Medicaid expansion on fertility. So if women decreased births as a result of this increased access to contraception and abortions, and I find a decrease in fertility following Medicaid expansion for some women, suggesting that there might be, you know, fewer unplanned pregnancies as a result.
Yeah, and it just occurs to me, I think another issue that might be relevant is also mental health, you know, postpartum, for example. And so is there any information or data that sort of looks at, you know, whether mental health utilization has increased as a result of Medicaid expansion? And if that's also, you know, helping women, you know, and with their health and certainly related to any sort of postpartum difficulties?
Yes, so there's definitely been work on mental health utilization more broadly, and actually California's postpartum Medicaid extension that I mentioned is specifically for women with a perinatal or postpartum mental health diagnosis. So they're particularly interested in that population, and actually mental health conditions are a leading cause of maternal deaths for some groups.
Oh.
So that's all definitely related, but I don't know of any work that's looked specifically at you know, postpartum depression care for women following Medicaid expansion.
Well, we'll have to look into it. Erica Eliason, thank you so much for joining us here today at Social Impact Live. It's been great.
Thank you so much for having me.
All right. Well, that concludes our show for today and also for our season. So I just want to say thank you to all of our great guests, to our wonderful team here that puts on the show week after week, and a big thank you especially to all of you, our audience. Take care, stay well. See you back in January. All right. Bye-bye now.